Welcome to the 2021 UNC Water and Health Conference. Thank you for joining our poster session. My name is Warner Passanisi. I'm representing the Water Institute here at UNC, and I'm your room host today for this posters session in room 3. Before we get started, I've just got a few announcements. I want to welcome the presenters and the participants. I want to encourage participants to attend the networking on REMO that is later this afternoon, showing on the slide. Instructions are on the registration or on the website for how you register and how you enter. Next slide, please. I want to encourage participants to attend the late early show, especially if you missed earlier sessions. We've got Farai Angela Tunhuma and Tina Kanathagigoda, who are going to be leading that or recap of the day's events, sharing their thoughts, especially on how it applies to Africa. Next slide, please. I want to encourage everybody to share your thoughts, your questions, your comments on the chat feature in Pathable itself, where that arrow is. The Zoom chat in here is going to be disabled for participants. Next slide, please. And we have 4 speakers today. So what we'll do is we'll do it alphabetical. I posted in Pathable the order in which we're doing it. I want to just go over a couple of technical instructions, please. This session is being recorded for folks who could not attend this live session. That includes everything in Pathable, so all of the chat. If presenters can't get to questions during their session, they can answer afterwards. Everybody but the verbal presenters have been muted. Again, all questions, please type in Pathable as well. So with that, I'm going to hand over to our first speaker, Jordan Brands. Please take it away.
I was a research fellow on Sanitation's Future Initiative team, working to improve the management of manually emptied pit waste in Nairobi's informal settlements. Pit latrines are a fact of life for most Kenyans, specifically those living in formal settlements where little or no formal sanitation infrastructure actually exists. Pathways to the pits are often narrow, difficult to navigate, and impossible to reach by exhauster trucks. There's no room to dig new pits, and there are so many users that natural decomposition is not an option. As a result, the community relies heavily on manual pit emptiers to collect the sludge and discharge it into informally designated sites, like ditches or the nearby Nairobi River. Given pit emptying is illegal per Kenya's constitution, these emptiers are often subject to beatings or forced to pay bribes. This untreated raw waste discharge represents a huge gap in safely managed sanitation value chain. Our focus narrowed in on the leakage after the pit is emptied and before the waste is dumped. The major benefit of working directly with the emptiers is that as their behaviors change, then the benefit can rise up the value chain. We wanted to use a human-centered design approach to understand how the manual pit emptying system works, who the major players are, and determine what the needs and motivations of the emptiers are. We conducted interviews with the emptiers, with local government heads, landlords, and community leaders to get a feel of the community. We also put together stakeholder relationship mapping to determine the power flow. Taken together, we determined there were 3 key issues that we needed to address. There was no formally designated dumping site. Emptiers have their own distinct working structure and do not have a set customer base. And there's also extremely heavy stigmatization of these emptiers. We developed a multi-step solution to tackling the sanitation coverage gap. The first was establishing a low-cost waste transfer station for the emptiers to use. A transfer station effectively operates like an underground septic tank, where emptiers can dispose of their pit sludge, and we can bring in exhauster trucks to safely remove the collected waste and deliver it for treatment elsewhere. The next step was to assist the group in formalization, including uniforms and a written constitution. This helps improve their status in the community as well as mandate the use of a safe disposal site. We learned early that the emptiers are the experts. They know their hours and needs, and it's our goal to meet their expectation. Treating emptiers like customers encourages them to use the site and gives them a sense of ownership, rather than they're viewing it as just some other project. Selecting a site near a previous disposal point is key. It has already been selected for some reason. Usually it's a convenient location for the emptiers or at some cross point for them. And the big one is it's already accepted as a disposal site. The latter is paramount to keep the local community engaged and supportive. No one wants their backyard turned into a disposal point, especially when their income relies on the food stand they operate out front. The caveat is to ensure that the site is easily accessible by exhauster truck, else safely disposing of the pit sludge is nearly impossible. We made sure to limit behavior change wherever possible, so emptiers are encouraged to continue using the site and feel like true customers while we cater to them. Currently, the system is expensive. We would have to charge the emptiers about $4 per barrel in order to break even, which is far too high for the emptiers to afford, as that's frequently the same price they are paid. Negotiations were early and settled on a 50-cent tipping fee, a price emptiers were willing to pay as it's lower, consistent, and more manageable than the bribes they previously faced. Especially since this fee gives them access to additional benefits, such as a place to shower and wash their gear. The gap in project funding illustrates a major project recommendation: gain government support. This may mean subsidies to keep the site operational, and certainly means local community and local government support. The site alone currently captures nearly 4 million liters of pit waste annually that otherwise would have been directly disposed of within the community. A second site has been established in another neighborhood in Peru, and a third site is under development. We're shifting our focus towards improving the process of manual pit emptying and in innovative solutions to manage the waste. The project has shown some unexpected surprises. The biggest one is that emptiers are in fact willing to pay for a safe disposal site and are demanding one. Despite the fact that emptying is technically illegal, there's a surprising push from the local community and regional governments to establish more sites and provide more services. People are keenly aware there's a problem with this sanitation gap, and it seems they're looking for partnerships to solve it. The paper of the same name on this topic has been published in Waterlines and contains more information and recommendations for other practitioners tackling the glaring issue of integrating pit latrine waste into the safely managed value chain. Thank you.
Excellent. Thank you, Jordan. I really appreciate that. Again, I encourage people, if you have questions or comments, please write them in the Pathable chat box. Jordan, the name pit emptier is, you're talking about stigmatization. Around the world, that's often given a different name. And any thoughts on how to introduce that job or that profession in a different way with local government, especially?
Actually, the perfect person to discuss this with is the person who is currently living this task. In this chat should be Wali Malungo. She's been leading the pit emptying project since it began several years ago. I believe she should be in this chat and might be able to provide some insight on thoughts about working with the government regarding stigmatization.
Yeah, I'm happy to provide thoughts on that. And really, the name pit emptier, for example, in our Kenyan context, is that they themselves call themselves this because they know that the work that they're doing is very important. And so even relating it to the government and supporting them, they wouldn't want to be confused with the vacuum truck exhausters who also call themselves emptiers. So for us, it's been a very interesting process getting to make them understand the value of formalization, being in groups, and then operating like sanitation workers. So right now what we're trying to do is moving them even from being referred to as pit emptiers, but really to sanitation workers, which they are really, they have really embraced. And even with the unionizing the emptiers into the CBOs, the community-based organizations, you'll realize that they come up with the CBO registration names and call themselves sanitation workers or cleanliness and sanitation workers within the communities, because that's how they would like to be referred to as by their own community members.
Excellent. I think there are models on similar forms of unionization elsewhere around the world that have been successful and also not successful. Let me see. Okay, just checking for other questions. Who would be a pit emptier? Is this a particular job just for one type of person? Females,
yes, so
children? Is there? Go ahead. Sorry, Wally.
Yeah, so in our context right now, especially in the Nairobi informal settlements, the pit emptier would be typically a male person, and they would be emptying the pit latrines very manually. So there's no form of mechanization because noting the challenges within informal settlements, they're very crowded, the streets are very narrow. It's impossible to bring in any form of mechanized emptying that could fit and work for the population around there.
Thank you. Any other questions? Ruthie Rosenberg is asking, can you share the most surprising or interesting finding or change since you launched the site? Oh, excuse me. That's for yet another question. Forgive me. Are you planning to replicate in other areas or look at if there are any areas that are mechanized?
Yes. So yes. Go ahead, Jordan.
I was just going to say it's just something that's currently in the works that I think Wally has tons of knowledge. I keep passing all of this along just because I'm absolute expert in the field.
Go ahead,
yes.
Wally, please.
So to answer that question, yes, the plan is to replicate the service as much as possible because we've really established it's a proof of concept to capturing more waste that would otherwise be going back into the same communities whom the emptiers are currently serving. And so what we are looking at beyond the 2 or 3 transfer stations is really also expanding outside the current Mukuru informal settlement itself to other areas of Nairobi, which typically also have pit latrines and have the same challenges. If you look at the Nairobi sheet flow diagram, at least over 60% of the waste that is being generated is not getting to treatment. And most of this leakage comes from pit latrines, which is going directly into the Nairobi River. So in the spirit of trying to bring government on board, our discussions have really been on around how do we clean up the Nairobi River, and really how are we able to now redirect all this waste and stop it from going into the river. And establishment of these transfer stations is what would work currently as a model, because people don't have any places to go, and MTS don't have places to go, and they would like these designated discharge points.
I love it. Use. I'm gonna, as wrapping up this Q&A, I'm gonna ask Ruthie Rosenberg to ask her own question. Ruthie, please, unmuting, go ahead. Thank you.
Great, thanks so much. I was just hoping, Wally, maybe you could comment on what has been just the most exciting or interesting thing that came after the launch of the site. Thinking a little less so about things that came before it, and now that you've been living and working this.
Great question or thoughts, Ruthie. So the most interesting thing for us is MTS embracing being customers and just agreeing to pay a fee for a service that they also deem very important to them. So just being able to have that designated discharge point, making sure that they are no longer stigmatized in the community because all their customers now know where they're taking the waste. They're facing less hassle from the government because the waste is now self-contained. And then the other thing is also seeing the MTS, once they have formed these community-based organizations or groups, wanting to even move a step further to improve the emptying process itself, making it safer both for them and the community. And in this case, reducing the exposure to the manually emptied waste, pit waste during both emptying and also transport up to the discharge points. So that has been very interesting for us to see them ask for this. One step that the MTS have also taken and embraced is use of PPE, for example. And given that we initially, as we were formalizing them, gave them an initial set, we have seen very great interest and pickup from them in terms of even replenishing the same PPE and continuous use of the same. And that's why right now, as Jordan has presented, that we are focusing on piloting how else do we improve the process itself to make it safer within the value chain beyond just having a discharge point.
Lovely. Thank you so much. We'll have to call that to an end, I'm afraid, now. Jordan, Wally, thank you very much for presenting. If there are further questions, please please have a look at the Pathable chat and follow up there. Thank you so much.
Thank you.
We're going to move across now to Jackie Nee, who is assistant professor at London School of Hygiene and Tropical Medicine. Jackie, take it away. Thank you.
Today, I'm going to be giving you a quick overview of some of the work that we did that looks at the relationship between wash and health factors and summary measures of the composition of the gut microbiome in young kids living in low-income neighborhoods of Maputo, Mozambique. For those of you familiar with the MAPSAN trial, this work was an extension of that project. So what's the connection between wash conditions and the microbiome? As I'm sure you're all aware, risk of exposure to enteric pathogens and indeed infection tends to be higher where access to wash surfaces is lacking and sanitary conditions are poor. So the frequent exposure to enteric pathogens that can result can lead to changes in the development or the composition of the gut microbiome, or what's known as dysbiosis. Dysbiosis, especially during the first 2 years of life, when multiple systems in the body are undergoing rapid development and maturation, can have long-term and potentially even intergenerational effects on health. So for example, dysbiosis has been associated with changes to immune system development and functionality, increased susceptibility to future infection, and impaired growth. Given these far-reaching effects, it's important to better understand what factors contribute to dysbiosis during this early stage of life. So with that in mind, the aims of our work were twofold. First, to assess whether access to an advanced on-site sanitation intervention, which was pour flush toilets that discharge to septic tanks, was associated with alterations in the composition of the microbiome among young children less than 3 years of age in low-income informal neighborhoods of Maputo, Mozambique. Second, we aim to identify what other wash-related, health-related, or demographic factors were associated with changes to the gut microbiome in the same population. So to achieve this, we sequenced stool samples from 171 children enrolled in the MAPSAN trial, 85 from children living in compounds that received the sanitation intervention, and 86 from control compounds that did not. From these sequencing results, we formulated 5 summary measures of microbiome composition: species diversity, also known as alpha diversity, antibiotic resistant gene abundance, or ARG abundance, ARG diversity, the abundance of genes encoding virulence factors, or VF abundance, and finally, the number of unique E. coli pathotype genes. So we assessed the relationship between these summary measures and a set of wash, health, and demographic factors. The top-line results from this analysis are presented in the graph as adjusted prevalence ratios. Along the top, you have a selection of the wash, health, and demographic factors that we tested, along with our microbiome composition measures along the y-axis, or our outcome measures. So first, if you look at the intervention section of the graph with the blue dots, you can see that the sanitation intervention had no strong association with any of our measures of microbiome composition, as the point estimates or their 95% confidence intervals all cross the null value of 1. While not significant, we did find a very small decrease in ARG abundance in the intervention group, and those are results that align with a recent meta-analysis that looked at the impact of wash access on ARG abundance globally. And while not shown here, we actually found no associations between wash or environmental risk factors and measures of microbiome composition. So interestingly, and maybe expectedly, we did find that reported diarrhea was associated with an increase in the abundance of ARGs, virulence factors, and E. coli pathotypes detected. And when we began to look at associations between specific pathogen detections and microbiome measures, the picture got a bit more complex and we found mixed associations. The final 2 conclusions relate to the relationship between age and microbiome composition. Consistent with past research, we saw a gradual increase in species diversity as children age. However, we also found that ARG abundance and diversity, virulence factor abundance, and the number of E. coli pathotypes all decreased with age. And that was a finding that was inconsistent with some previous work that we'd done in the same study population that looked at ARG abundance using a different method. Finally, it wasn't totally surprising to us that we didn't find any strong relationships between the intervention and changes in the microbiome, given that in the main trial results, we found no effect of the intervention on enteric infection in the same population. Thanks for listening. I'm looking forward to your questions.
Lovely. Thank you very much. Again, just asking for questions that you might have or comments to be put in the Pathable link. Let's see what we have. Just while we're waiting, Jackie, were you surprised by that no effect on sanitation, your first graph?
No, we weren't super surprised about this, largely because when we look at the main trial results, we did not find any effect of the intervention on enteric infection. And sort of our hypothesis here, the pathway here that we're assuming dysbiosis would occur through is enteric infection. So if we're not seeing a reduction on enteric infection, we thought it unlikely that we would also see a difference in sort of microbiome composition.
Thank you. Also, if it's easier, please feel free to wave in reactions at the bottom right if you wanted to add anything, and we can actually hear from you like we heard from Ruthie earlier. What plans for continuation expansion of this work, Jackie?
So this is a very small subset of the results from this paper. As anyone who's ever worked with metagenomic results can attest to, you end up with a lot of data that you can analyze in sort of every which way. So there's quite a few more results for this one paper, and this is actually an extension of a larger project. So instead of extending this work, this is actually the extension portion of the MapSan trial. But what I will say, which I think is interesting, it's really hard to see on the graph here too, is we saw a very small decrease in overall ARG abundance. And when you look at individual sort of classes of different antibiotics, we see a reduction across most of those classes, except for just a few, which is probably why the overall reduction in our prevalence ratio is pretty small. But just to note that this is aligning with some pretty exciting new work that I think she's presenting it at the conference this year, but Erica Furmeister did, that looked at wash access sort of in general and ARG abundance, and found sort of an overall, again, I think a small decrease in ARG abundance associated with better wash access. And our results were actually included in that analysis. So it's nice to see that, but again, it's a pretty small effect, and we're not surprised by that, or small association in this case.
Nice, thank you, Jackie. A question from Maya Nadimpali. How common was antibiotic consumption in this population? Was there any effect of the intervention on antibiotic use?
That's a really good question, Maya. We unfortunately didn't actually measure antibiotic use in this, but knowing sort of just the Maputo area, antibiotic use is really, really common, and it's often sort of taken from pharmacies without any sort of prescription. There's a lot of sort of self-diagnosis and medication with antibiotics here. Mostly tetracyclines, beta-lactams, bactresins are the major ones that you see in Maputo. But again, we weren't able to, we chose not to measure antibiotic use as part of the MapSan trial, so we don't have any data on that, so I can't speak to whether the intervention reduced use. It didn't reduce infection though, and if that's sort of a proxy for diarrhea and a proxy for use, then maybe not.
Wonderful. Time for one more question, if there's another one. No. Okay, Jackie, thank you so much. If there's any follow-up in the Pathable chat link, please go and look and add to that. That's a really interesting study. Thank you so much. Okay, we are moving along to Ana Vergara Leon in Lima, in Peru. SANAS, with the National Superintendency of Water and Sanitation Services, the coordinator there. Ana Vergara, let me hand over to you. Thank you.
Hi, my name is Ana Vergara. I work at the National Superintendency of Sanitation Services, SANAS, in Peru. and I want to share with you the orientative inspection in rural areas. SUNAS is the regulatory body for the provision of sanitation services in urban and rural areas. In addition of setting tariffs, the regulator has the supervision function. Who provide the sanitation services in rural areas? In rural areas, services are provided in more than 90% of the cases by community organizations. In the other cases, the services are provided by municipalities. It is also important to say that when we talk about sanitation services, we are talking about water, sanitation, and wastewater treatment. The population in rural areas is 21% of the total national population, that is 33 million inhabitants, and there are about 24,000 of community organizations. In each district of the country that contains at least one rural population center, that is with less than 2,000 inhabitants, the municipality must have a municipal technical area that provides technical assistance to the community organization and registers all the community organizations in the district. The water disinfection levels in rural areas are very low. 2.7% of rural population consumes disinfected water. And what are the consequences of low levels of water disinfection in rural areas? High levels of acute diarrheal diseases. 10% of children under the age of 3 years have these diseases. Chronic child malnutrition. 24% of children under 5 years of age suffer of chronic child malnutrition. And also anemia. 48% of children under 3 years of age suffer from anemia. And what is the regulation strategy? The regulator issued the following standards: the service provision quality regulation, the family fee calculation methodology. It is important to tell you that in the rural areas, we don't have tariffs, we have the family fee. The regulation of the control for community organizations was elaborated with a focus on orientative inspection with benchmarking that contributes to performance improvement through the learning of good practices and builds a roadmap to improve performance. The orientative inspection consists in evaluating the provision of sanitation services and providing guidance during the inspection to the community organization and the municipality technical area in the actions that must have been taken to improve the quality of service provided. Also, the regulator has organized since 2018 the benchmarking of community organizations with focus on water disinfection to identify good practices that are disseminated annually in 25 workshops among the community organizations so that they can learn from their peers and thus improve their performance. The regulator also verifies annually the implementation of the recommendations made the previous year. And SUNAS has also developed a web system where the municipal technical areas record performance information on community organizations that allows for updated information of more than 17,000 community organizations every 6 months. And what results are expected? In this context of orientative inspection, our aim is to modify the behavior of the community organizations in order to achieve a better performance to improve their life quality. This is also why benchmarking has an important role in behavioral change in community organizations by establishing an improvement path that also involves monitoring the commitments assumed by the community organizations to improve their performance during the workshops. Thank you for your attention.
Thank you so much, Ana Vergara. Again, any questions or comments you have, please raise your hand in reactions bottom right or type your question in the Pathable chat box. Ana Vergara, can you go over some of the factors you were starting to discuss about the the acceptance of inspection, how that fits into municipal practices and within rural communities?
Well, for the first time, it was difficult for us to reach the community organizations because we have been working for more than 20 years with the water utilities. So our experience is so urban, many urban utilities. But to reach the community organizations, we had to make something different. We have to orientate themselves. Not only we are here to supervise you, and if you don't accomplish the rules, you are going to be punished. No, that's not. We have to orientate them, to tell them that it is better to be supervised in order to improve their performance and the quality of service that they are giving to the citizens or to the people in the community organizations.
I love that. I mean, looking at the previous presenter as well, the idea of how unionization, getting similar groups together with a common element, can be successful. Is that an element you're looking at as well? There seem to be many community organizations you have. Is there a way of coalescing that focus?
We have more than 24,000 of community organizations. There are a lot of community organizations. Most of them have only 50 people in the community organization. Our legal framework tries that the community organizations are going to be part of the water utility in the future, because alone they are not sustainable. The services are not sustainable in so small communities. So we tried to make a match with the water utility, the municipality, with the municipality technical area and the community in order to improve the performance so that they can be helped by the municipality and the water utility. And maybe one day they are going to be part of the water utility and not be alone in the rural areas.
Is there any standardized approach in how you're suggesting community organizations should look at this?
We have the legal framework for this. And we are working to improve this and to make them, the community organizations, near to the water utilities.
Well, good luck with that. Thank you. Are there any more questions? I hate hogging all of the questions, but please feel free to speak up. We got one more minute. If not, Ana Vergara, thank you so much. Really appreciate that. Again, all the materials will be available through the Pathable link. Thank you very much, Ana Vergara. We'll move on to our final poster presenter, Bruce Rutayisire, who's in Kigali in Rwanda. He's the lead engineer at Pit Pumpers. And Bruce, take it away.
Hello, my name is Bruce Rutayisire. I'm Research and Development Lead Engineer at Vergara. I'm here to present a case study entitled Time and Motion Assessment of Pit Emptied Operation conducted in Kigali, Rwanda. This study was carried out by Vergara, a social enterprise that provide fecal-sludge collection and transportation service that focuses on serving low-income households. Some background facts related to this study are that traditional sewage infrastructure remains unaffordable for community and governments in low-income contexts. This makes road-based fecal-sludge collection and transportation the best alternative. The other fact is that 2.7 billion people use on-site sanitation in the whole world, where 1.77 billion use some form of pit latrine. Previous research has shown that there is a gap between low-income household willingness to pay and the actual cost of fecal-sludge collection and transportation services. One of the solutions that Vergara is looking into is to optimize emptying process by identifying time-intensive tasks and understanding the serviceability of different types of facility. This will help us prioritize intervention that can improve efficiency and drive down overall cost of the service. In the end, we'll be able to pass savings on two low-income households. During the study period, time and motion data for So 925 jobs were recorded. Here, discrete duration for each task was recorded. Those tasks are pumping preparation, trash fishing, pumping, cleaning, and repairing when necessary. All those tasks were recorded. The other data that were recorded were types of on-site facility and emptying method used to serve those facilities. Technology that Vergara uses to serve its customer, we have the mechanized emptying method, also known as conventional vacuum truck, that serves middle, high income, and institution with road access, as you can see on the picture. The other method is a semi-mechanized emptying method that combines a portable vacuum pump that pulls sludge from the pit into these small barrels, and a manual lever that carries these small barrels from the household up to where the truck is parked. As a result from this study, we learned that pit latrines takes longer to serve compared to other types of pit because they took around 250 minutes, while other types of pit takes less than 200. It also showed that trash fishing, which consists of removing solid waste disposed inside the facility, and pumping are the main time-consuming activity with more than 60% of the total process time. The study also highlights that pit latrines is the most common form of on-site sanitation facility because around 53% of the total jobs were pit latrines, while septic tank and soak pit took 47%. Looking at the method to serve pit latrines, we found that only 39% of pit latrines served were accessible by vacuum truck. The rest were served by a semi-mechanized emptying method. However, we also learned that semi-mechanized emptying method takes longer because they took around 300 minutes, while mechanized emptying method or vacuum truck takes less than 200. As conclusion, measures to reduce lengthy trash fishing tasks should be prioritized. Here we recommend the use of toilet seat that prevent trash from entering the pit, or using pour flush toilet, and also improving solid waste collection strategies in hard to reach areas. The other recommendation or conclusion from this study is that since the demand of semi-mechanized emptying method exceeds that of vacuum truck, improving their process time and labor demand should be prioritized so that we can reduce the cost of that service and make it affordable to low-income household. For more information about our work, please follow us on our Twitter at Vergara, or check our blog posts at Medium, or visit our website mentioned here. Thank you for your attention.
Bruce, thank you very much. Common theme of pit emptying as well. I really appreciate you joining us. Again, any questions you might have, please feel free to raise your hand, speak up, or write in the Pathable chat. I wonder, Jordan or Wally, do you have any comments or similarities between your study and Bruce's in terms of even just the mechanization approach? I think is quite interesting. Bruce, so for the pit emptiers, can you maybe discuss in a similar fashion from the first presenters the viability of that role in the community? Is that a job that is stigmatized? Is it valued? Is it paid well? Is it full-time? How can you encourage that?
Okay, thank you. Most of the employees that we have who are actually working as pit emptiers used to do those manual emptying before, but when we ask them to join our company, provided with equipment, provide them with all the necessary like insurance and other things, they started feeling like it's a normal job compared compared to what they were doing before. So they were eager to join, and some of them are happy with it. And we always get like requests for jobs from those manual emptiers who have not joined our company yet. I would think, yeah, manual emptiers are still stigmatized when they are working unknowingly, but when they are having the necessary equipment and working professionally and in a clean environment with necessary tools, they tend to feel like it's a normal job like any others. So
that's really interesting and understandable, I guess. What's the pay conditions like for the two types, manual and mechanized?
okay, so for the manual MTRs who works, I can say illegally, they charge around between 20 to 40 random thousand, okay, 20 to 40 US dollars per to empty one pit, and they have to divide it in their number and according to how many they are. But our normal employees, they are paid per, when they are serving a low income area, they are paid per job. So each job per day, we pay them 8,000. That means like $8 US. And if they do 2 jobs on a day, they can get around 16.
Excellent, thank you.
Also have those other.
Couple more questions. I'm going to ask Gemma. Gemma, would you be willing to ask your question directly, please?
Hello, and thank you for your presentation. It's been very interesting. I had a couple of questions. You mentioned the amount of minutes that the emptying took under different conditions. Was that just the time of the actual emptying on site, or did that include the time traveling to the disposal site? And in all cases, are there safe places for the waste to be dumped, or was some of the waste disposed of unsafely?
Okay, thank you for the good question. So for this study, we only counted the time we started counting when they reached the site, and we stopped counting as soon as they were stopped and ready to go to the dump site. And so we had some errors in the data collection for the traveling part. That's why it was not assessed in this study. But we recognize that traveling to the dump site or where they have to dump it is also a big part as a time-consuming activity.
Lovely, thank you. And let's finish off. Wally, would you care to ask your question directly as well, please? Thank you.
Yeah, sure. Thank you, Bruce. This is a very great presentation, and I'd just like to understand what are the semi-mechanized methods that you highlighted in the presentation.
Yeah, as I shown in the pictures of some of the method we use to serve our customers, a semi-mechanized method, we have a flatbed truck that carries the barrels and equipment and employees up to the customer place. And when we get there, the employees and they unload and carry those equipment to the containment system site, and they use a portable vacuum pump called pit vac to pump the sludge from the pit into those small barrels that are then carried back to the truck and then being transported to a designated dumping site.
Great, that's thank you so much for the answer. And to just answer your earlier question, one on parallels that we could draw or differences between Pit Vidura and Fresh. It is so one thing that we've noted with the emptiers in Nairobi's informal settlements, and especially Mukuru, they are not so much into mechanization because it's very hard to actually get anything mechanized into those very hard to reach places because of the crevices. Sometimes even what they use very manually, which is the ambulances and scoops and buckets, they have to even park the ambulance at least a few meters away from the plot. So ambulances can't even get to the plot. And so one of the things that we've been trying to also look at is what would ease in that emptying process without disrupting the methods that they're already using, but just complementing it and making it a little bit safer.
I think that's a really interesting point, looking for alternative methods, innovative methods that may not involve an engine as well in small, difficult places to get to. Wonderful. I can imagine if this was an in-session, an in-person conference, we'd be talking about many of these issues together around the water cooler. Apologies, we can't, and we're out of time now. I want to thank Bruce. Thank you very much. All of our presenters. All of the presentations are involved in that Pathable link you used to join. I want to thank everybody for attending. We have a special session of networking and sponsor booths in 15 minutes. I encourage you all to attend that. If not, hopefully see you all tomorrow. Again, the recording for this will be available fairly shortly after this through that Pathable link. Thank you everybody for attending. Have a wonderful evening.